Hello, my name is Nathaniel Anaya, and my presentation is going to be about autism spectrum disorder. What is autism spectrum disorder? It is a group of developmental disabilities. They cause a range of different communication and behavior challenges. A spectrum disorder means that disability affects everyone in a different way. The symptoms can be very mild or can be very severe depending on each case. As of recent research, it now shows that 1 in 80 children are being diagnosed on the autism spectrum. This is a big jump from 1 in 110 from just last year. The three different types of the autism spectrum disorder are autism, Asperger's syndrome, and pervasive development disorder, not otherwise specified, PDD, and OS. Autism. Autism disorder is normally what people think of when speaking of autism spectrum disorder. People with autism usually have significant language delays, social and communication challenges, unusual behaviors and interests. Many people with an autistic disorder also have intellectual disability. However, on the other hand, an incredible academic ability in what they are interested in, usually math or science. Due to the language and social delay, it is the most common reason as to why they have trouble with subjects such as reading or writing. For example, of the incredible academic ability, last year when I was student teaching, I had a child in my class who had autism, and he was incredible in science. He took a very specific interest in dinosaurs, and every day he had a new fact about a different dinosaur that he would share with me as well as the class. Asperger's. People with Asperger's syndrome usually have some milder symptoms of autistic disorder. They might have social challenges and unusual behaviors and interests. They typically do not have problems with language or intellectual disability. It affects their ability to communicate and socialize effectively. Most people have a hard time reading emotions from others around them with Asperger's syndrome, which in return does not allow them to respond appropriately at times. For example, when someone is crying, a person with Asperger's syndrome might be laughing. Or when they want to show an emotion and people do not respond as they want, it could lead them to become very frustrated and at times aggressive when misunderstood. Pervasive developmental disorder, not otherwise specified, PDD and OS. People who meet some of the criteria for autistic disorder or Asperger's syndrome, but not all, may be diagnosed with PDD and OS. People with PDD and OS usually have fewer and milder symptoms than those with autistic disorder. The symptoms might cause only social and communication challenges. People with this disorder may have one minor symptom as well as one debilitating symptom, and they have difficulty understanding emotions. The defining features of this disorder are usually challenges in social and language development. The diagnosis is still relatively new, maybe 15 years old, so the diagnosis is still a little tricky and being looked into. What to look for. Social skills. Does not respond to name by 12 months. Avoids eye contact. Prefers to play alone. And does not share interests with others. Communication. Does not understand jokes, sarcasm, or teasing. Gives unrelated answers to questions and does not point or respond to pointing. Unusual interests and behaviors. Is very organized, gets upset by minor changes, and has obsessive interests. For example, he gets upset by minor changes. The child that was in my class, his dad at times would have to go on business trips, and this minor change in his normal schedule would set him off, so he would have restless nights and wouldn't sleep very well. So if he ever came into class tired, we knew that his dad was out of town. Another thing is he loved dinosaurs, so every Saturday his mom would take him to the Natural History Museum so he could do more research. And if he missed his Saturday field trip, he would become very frustrated and upset. And on Mondays when he would come in, he would keep to himself pretty much for the majority of the day and wouldn't share with us another fact about a dinosaur. As for obsessive interests, he was very, very upset. He was very interested in dinosaurs. When playing, they will line toys up in a certain way or only use one color. Other symptoms, they have short attention span, aggression, causing self-injury, temper tantrums, unusual eating and sleeping habits. As for temper tantrums, it goes back to the change of schedule. If he did not go on his field trip on Saturday with his mom, then he would throw a temper tantrum and it would go throughout the weekend. As for self-injury, if a person with autism has a hard time expressing feelings with others and self, they might inflict a self-injury. This slide just is showing you different characteristics and various combinations in the degree of the severity of autism. For example, difficulty in interacting with others, inappropriate laughing or giggling, and has no real fear of danger. Diagnosis. Developmental screening, a short test to tell if children are learning basic skills when they should. The doctor might ask the parent some questions or talk and play with the child during an exam to see how the child learns, speaks, behaves, and moves. And a delay in any of these areas could be a sign of a problem. Research has found that autism spectrum disorder can sometimes be detected at 18 months or younger. By age 2, a diagnosis by an experienced professional can be considered very reliable. MChat is one of the most reliable resources out there right now to test a child for being on the autism spectrum disorder. A parent can complete the items independently. The MChat does not allow a clinician to make a diagnosis of an autism spectrum disorder, but is a very useful clinical tool that has excellent sensitivity and is very specific. Positive results suggest a high risk for an autism spectrum disorder. It consists of 23 questions for a parent or legal guardian to answer. This right here is an example of an MChat. I'll go over the instructions and give you guys a couple of examples of what it asks. Instructions for taking and scoring the MChat. A child should be referred for further evaluation with any 3 answers. Suggest risk for autism spectrum disorder as indicated by the list of autism spectrum disorder risk responses that follow the questions. Please answer questions to reflect your child's usual behaviors. If the behavior is rare, example, you've seen it only once or twice, answer as if the child has not acquired the behavior. Question 1. Does your child enjoy being swung, bounced on the knee, etc.? Question 2. Does your child take an interest in other children? Those are just some of the examples of the questions. Does your child look at your face to check your reaction when faced with the unfamiliar? Question 22. Does your child sometimes stare at nothing or wander with no purpose? That's just a few examples of the MChat. Early intervention. Most important thing for a child's well-being. Early intervention services help children from birth to 3 years old. Services can include therapy to help the child talk, walk, and interact with others. It is important to talk to the doctor as soon as possible if you think your child has an ASD or other developmental problem. These services are provided through an early intervention system in every state. If you want to look further into autism spectrum disorder, here are a list of my references that I used for this presentation. Thank you for your time.